Marcus David Peters was 24 when he was killed by police in Richmond, Virginia. An officer shot him twice while he was experiencing a mental health crisis. As calls to defund and abolish America's police grow louder and louder, many mental health experts and advocates are also weighing in. Specifically, they're demanding that police no longer be the first responders for dealing with any sort of mental health crises. This concern is a lot more urgent than you may think. Folks with mental health challenges are 16 times more likely to be killed by law enforcement. It's also why choosing not to call the police during mental health emergencies isn't a decision Black people take lightly. Because of the roughly 1,000 people killed by police in 2018, at least 25% of them experienced mental health challenges. After thousands of people with mental health concerns were moved out of institutions, like hospitals and asylums in the 1950s, it was during the 1960s police started to become the first point of contact for people dealing with mental health crises. And by the early 1980s, federal spending for mental health resources in the US was slashed. Just a few years later, in 1988, the Memphis Police Department established the first Crisis Intervention Team program in order to respond to mental crisis events. And though there are CIT programs in 45 of the 50 states, there's not a whole lot of data to prove they're even effective. A 2015 survey by the Police Executive Research Forum found that on average, new officer recruits receive 8 hours of crisis intervention training. For context, those same trainees receive almost 60 hours of firearms training. According to the National Alliance on Mental Illness, 40% of adults who deal with mental health concerns will come into contact with the criminal justice system during their lifetimes. In fact, 20% of people in jails and 15% of state prisons populations are categorized as having, quote, a serious mental illness, unquote. That's over 350,000 people. So when a racist mass incarceration system meets false stereotypes about violent people with mental health challenges and an inadequate holistic healthcare system, Black people are left especially vulnerable.
What you have is a phenomenon whereby Black men who are seen on the street as perhaps being disruptive in some way tend to get taken to the station house. They tend to get arrested. They tend to get booked, and they tend to get detained. At the other end of that spectrum, white women who are disruptive on streets will tend, this is obviously not 100%, 0%, but they'll tend to get taken into the mental health system, perhaps to psychiatric emergency rooms or to other kinds of mental health facilities. And there's a spectrum here, so that perhaps Black women will fit in a different place on that spectrum. White men will fit in a different space on that spectrum. So this is gendered, and it's also connected to race. And in jail, there's not going to be anything resembling a decent mental health system. And if you become at all physically aggressive under the extraordinary stresses of a prison, then you are going to be seen as even more of a problem. You might be put into harsher conditions because the whole system is set up to be punitive. The prison guards are probably even less well educated than the cops on the street when it comes to these issues. You're going to be at high risk of being brutalized by the prison guards and perhaps by your fellow prisoners. You're not going to get anything resembling decent psychiatric care by the time the system spits you out onto the street. Is going to probably put you in even worse condition psychologically through this repeated trauma for the duration of your incarceration.
Across the US, there have been efforts made so that police aren't dispatched for mental health emergencies, and they're working. Like in Eugene, Oregon, where community-based first responders of crisis workers and medics have attended to public safety calls, including mental health crises, for over 30 years. And in 2019 alone, they received 24,000 calls. Albuquerque, New Mexico plans to create a new department designed to handle homelessness, addiction, and mental health calls. Similar alternatives in Los Angeles and San Francisco are also working towards policing alternatives.
Having the capability to deploy folks trained in street mental health on an emergency basis, as well as to deploy them on a non-emergency basis, is critical. And if 9/11 workers could make a judgment as to which kind of expertise is required, rather than always sending a cop, or almost always sending a cop, that would be a huge step forward. And I'm actually pretty optimistic we could be at a kind of once in 50-year moment of surging forward when it comes to what needs to be done.
The time for change is now. The defund the police movement is calling for divestment from massive police budgets and a relocation of financial resources back into communities. It's crucial that we pour into underfunded and necessary social programs, like those that prioritize mental health, education, and housing. The American policing and healthcare systems are broken, and that fact is incredibly evident in how mental health emergencies are handled in this country. Because no one should die or go to jail when all they really need is some support.